I'm Paul Roseno, and I work as a compliance specialist in OHA's hospital staffing program. OHA's hospital staffing complaint system is how Oregon's hospital staffing laws, including the updates in 2023's House Bill 2697 and 2025's House Bill 3294, are enforced in Oregon. In this short video, we'll describe the types of violations that OHA is authorized to investigate, including a violation that was added to ORS 441792 as part of House Bill 3294 in 2025. The hospital staffing law includes many requirements. OHA can only investigate and enforce the requirements that are listed as violations in ORS 441792, subsections 2 and 3. Currently, OHA is authorized to investigate nurse staffing complaints related to failure to adopt a hospital-wide nurse staffing plan. OHA reviews those complaints about adoption and enforcement of nurse staffing plans to determine if the nurse staffing plan was adopted by the Nurse Staffing Committee or through arbitration on or after September 1, 2023. Plans adopted prior to September 1, 2023 must be reviewed and readopted by the Hospital Nurse Staffing Committee after September 1, 2023 to comply with current law. Failure to comply with the staffing levels in the adopted nurse staffing plan for a unit. These staffing levels can be written as ratios or minimum numbers on shift. The staffing language in the adopted nurse staffing plan must reflect that the staffing is required and not aspirational or optional. For more information on enforceable staffing plan language, see the OHA Hospital Staffing Short on enforceable and unenforceable language. In these investigations, OHA also looks at whether the failure to comply is an allowed deviation. If a violation is found, OHA looks at whether the safe harbor requirements have been met. Failure to comply with statutory RN to patient ratios in a unit that does not have an adopted staffing plan and is one of the unit types listed in ORS 441765. In an investigation, OHA will review whether the hospital has adopted a plan for that unit and confirm that the unit is one of the unit types listed in ORS 441765. If OHA determines that no plan was adopted by the staffing committee, then the hospital is required to comply with the statutory nurse-to-patient ratios. In these investigations, OHA also looks at whether the failure to comply is an allowed deviation. If a violation is found, OHA looks at whether safe harbor requirements have been met. For more information on the application of statutory nurse-to-patient ratios, see the hospital staffing short on statutory ratios and non-ratio units. Failure to comply with the maximum patient assignments for certified nursing assistants as described in ORS 441768. OHA will review whether the CNA assignment exceeded the limit set of 7 patients on a day or evening shift or more than 11 patients on a night shift. Requiring a nurse staffing member to work mandatory overtime. The mandatory overtime law identifies nurse staffing members as registered nurses, licensed practical nurses, and certified nursing assistants. For more information about mandatory overtime limits and exceptions, see the hospital staffing short on mandatory overtime. OHA is authorized to investigate professional technical staffing complaints related to failure to establish a hospital professional technical staffing committee. OHA reviews whether the hospital has formally established the required committees that includes an equal number of professional technical members and professional technical managers. Failure to create a professional technical staffing plan. OHA reviews whether the Professional Technical Staffing Committee has created and approved a staffing plan which may include the CEO or CEO's designee selecting from disputed plan parts. Failure to comply with Professional Technical Staffing Plan staffing levels. OHA investigates compliance with the professional technical staffing levels that are reflected in the staffing plan. In these investigations, OHA also looks at whether the failure to comply is an allowed deviation. If a violation is found, OHA looks at whether safe harbor requirements have been met. OHA is authorized to investigate service staffing complaints related to failure to establish a hospital service staffing committee. OHA reviews whether the hospital has formally established the required committee that includes an equal number of service staff members and service staff managers. Failure to create a service staffing plan. OHA reviews whether the service staffing committee has created and approved a staffing plan which may include the CEO or CEO's designee selecting from disputed plan parts. Failure to comply with service staffing plan levels. OHA investigates compliance with the service staffing levels that are reflected in the staffing plan. In these investigations, OHA also looks at whether the failure to comply is an allowed deviation. If a violation is found, OHA looks at whether safe harbor requirements have been met. OHA is authorized to investigate hospital staffing complaints related to failure to release a nurse staffing committee, professional technical staffing committee, or service staffing committee member to attend their respective staffing committee meetings. OHA reviews schedules and time records to determine whether the hospital released committee members from patient assignments or other assigned tasks so they could attend meetings. For more information about types of violations questions and hospital staffing resources such as FAQs, webinars, and hospital staffing shorts, visit the hospital staffing website at www.healthoregon.org/hospitalstaffing.